Flo Sinus Care is specifically designed to irrigate and cleanse the nasal and sinus cavities using a large volume of fluid and positive pressure. Here's how to use Flo Sinus Care. Wash the bottle with mild dishwashing detergent. Use warm water and then rinse well. Dry with a paper towel. Reassemble the bottle, dip tube, and cap. Your device is now ready for use. Add 200 milliliters of lukewarm pre-boiled water to FLO Bottle. Add contents of 1 FLO sachet to FLO Bottle. Close FLO Bottle with cap and gently shake until all of the Flo Sinus Care granules have dissolved. Lean over a basin or sink and put your chin as close to the chest wall as possible. Now start breathing through the mouth and insert the top of the cap snugly into one nostril. Firmly but gently squeeze the bottle until solution starts to drain from the other nostril. Continue until half of the solution has been used. Then withdraw the bottle from the nostril and allow it to refill with air. Now repeat the procedure in the opposite nostril with the remaining solution. Gently blow your nose to get rid of excess fluid. Finally, you need to clean the Flo Sinus Care device. Disassemble the device and rinse all components in running water. You should then thoroughly dry all the components with a clean paper towel. Ensure you reach down into the bottom of the bottle to get it perfectly dry. Shake the dip tube to get as much water out as possible. Remember that bacteria love water. The drier your device, the less the chance of unwanted bacterial contamination. Reassemble the components so that your Flo Sinus Care is ready the next time you use it. Best results depend on regular washing of the nose and sinuses. Please read the enclosed consumer leaflet before use. Always follow the advice of your physicians. If symptoms persist, consult your doctor.